Để tiếp tục chương trình thì chúng tôi xin giới thiệu một bài báo cáo có liên quan đến một cái dụng cụ để dự phòng cái huyết khối ở trong rung nhĩ. We have an honor to introduce Dr. Dongming Hou about the Watchman FLX device. Please.
Good morning, good afternoon. Thanks, meeting organizer invite me give a talk. Dear chairman, dear distinguished panelists, today my talk is device evaluation and device evolution and clinical applications from Watchman to Watchman FLX and beyond. This is my disclosure information. As we all know, in non-valvular AFib, more than 90% of stroke-causing clots that come from the left atrium are formed in left atrium appendix. This is a case report which showed the clot migration from LAA to left atrium, which likelihood will go to the brain, cause stroke. As we all know, left atrium appendix closure is a safe alternative to long-term anticoagulation therapy, which offers comparable stroke risk reduction and enable patients to stop taking anticoagulation. It also demonstrated statistically superior reductions in disabling and fatal stroke, major non-procedure related bleeding and cardiovascular deaths compared to oral anticoagulation. Candidates with non-valvular AFib who meet below criteria may consider left atrium appendix closure. Watchman FLX device is built upon a strong foundations established by Watchman, and which is also the most studied and mostly implanted left atrium appendix closure devices in the world. You can see from 2002, start first in men trial to 2020, so over 18 years now from Watchman, the different generation of Watchman devices. Now, clinical generation of Watchman, mainly they have 4 representative devices. The initial clinical concept used Watchman generation 1.0 to 2.0, which is first the man study, and the commercialized generation, which also utilized for PROTECT-AF PREVAIL trial. As so far, it's more than 150,000 patients received Watchman Gen.25 implantation. And along the device iteration, you can see from the longer device going to shorter device, also close-end design devices, to now Watchman FLX, which is initial experience did by Pinnacle trial and in the just published in circulation for IDE trial. The design goal from Watchman to Watchman FLX is advanced safety, secondly, advanced procedure performance, thirdly, improved outcome and expand treatment patient population. So to advanced safety is we thought about thought about close end, which is is more safer, prevent perforation, distal perforation, and in the meanwhile we also added a recapture anchor, which allowed the device to fully recapture. Remember, earlier generation 2.5 is partial recapture. And then in the meanwhile, we also increase the stress density, which make the device is more conformed to LAA anatomy. So in the end, we have a smoother recapturable surface, which is more round. So here is a current generation, and then here is the newer Watchman FLX generation. And from Watchman 2.5 to Watchman FLX, there were 55,000 engineer hours of design optimization, the devices. You can see advanced computer design, the anchor, and the dynamic stabilizing testing, and the extension prototyping and optimization of the devices. And also, we have translational research, which we plus like 14 animal studies, and for proof its biology safety. You can see the histology response at 45 days and 90 days, both covered by new endocellularization in animal model. And our translational study also reported to TCT in 2014. Compared to the Watchman and the Watchman FLX, you can see Watchman FLX fully recapturable and redeployment, and a double row of anchor make the device more secure. Close end, particularly you can see Watchman ball. And the treatment range is really more wider, from 14 to 31.5 millimeter appendix. Here is the first task to advance safety was to create distal Watchman FLX ball. You can see the video, the left video, which demonstrates mechanical happens when Watchman FLX ball is advancing into the wall of LAA. We found that its deflection is useful in clinical, almost like a sensor to indicate the device has most of contact to LAA wall. Video on the right, you can see the right illustrates the stiffness of the ball, which is more conform to the LAA anatomy. And for the advanced safety, another design is double row of process anchoring, which is allowed, and the device fully retrievable and recapturable. This is the deployment more flexible. You have two ways to deploy this newer Watchman FLX devices. First, unsheath method. You can align implanted shoulder to the ostium, and advanced method, align delivery system marker band at ostium. Actually, we found most of the physicians, they combine both deliver methodology. So again, this is a Watchman FLX surface, it's more circled, and with 18 struts anchoring, and compare with Watchman 2.5, is more around 77% reduction metal exposure, which means accelerate healing process. This is the newer size selection. It's cover more widely range compare 2.5. So I will briefly go through the Pinnacle FLX trial, which is the USIDE trial. Enrolled 400 patients in 29 US sites. And here is a timeline of this trial. You can see follow-up 7 days, 45 days, 6 months, 1 year, 18 months, and 2 years. This is the primary efficacy endpoint, which is first time utilize device implantation as a efficacy endpoint, and also clearly have a safety endpoint, second endpoint I will not rate. From this demographic table, you will see the mean CHAS-BAS score is 4.2, and mean HAS-BLAS score is 2.0. It's a real life, real practice patient. So you can see at 12 months, primary endpoint was significantly lower. The event rate was reached, and also the primary efficacy endpoint was achieved. Effect closer LAA in 100%. So here is the upper confidential boundary of 5.3%. It's less than the perform goal. Preset perform goal is 8.7, much less than that. Therefore, the endpoint has met. So here is the outcome of 24 months. I will not read this. You can read from this bar graph. In general, very low event rate. And also the bleeding rate, also pretty low. Almost no pericardial effusion, only 1%. And in summary, Panicle FLX trial meets the key secondary endpoint. 3.4 stroke systemic embolization was below the pre-specified performance goal of 8.7%. And between 12 and 24 months, one additional patient have ischemic event and no additional DRT systemic embolism and pericardial effusion requiring intervention beyond those reported at 12 months. No evidence embolization with Watchman FLX through the 24 months. Here is the case I will show you as from Panicle FLX trial. You can see this patient measurement at 135 degrees, 22 millimeter, and the length is 25. Based on this, you can selection 31. Here's the implantation. You can see LA angiogram shot, and then this is release of the device. You can see the device release. The first release slightly shoulder, and then the operator really showed the shoulder. You can see from the TE view, and then the operator fully recaptured, redeployed. You can see the shoulder almost disappeared. So you can see compares the first deployment and the second deployment and the different shape of the devices. It's more suitable compared with the upper panel, the first deployment DE, and the lower panel, second deployment, you can see almost no shoulder. And the Watchman evolution continue. The newer version, I will not, because time limitation, I will not read all of this. We will continue to improve the device performance. In summary, Watchman clinical evidence with more than 6,000 patients and over 18 years experience from 2002 pilot first in man study to 2020 approved Watchman. FDA approved device, Watchman 2.5 and Watchman FLX. And further therapeutic consideration for LAA occlusion includes simply optimal technique or direct compare with oral anticoagulation and expansion patient population. Thank you for your attention.
Thank you, Dr. Dongming Hou, for your presentation about the latest generation of the device for prevention of thrombus in